Thank you, Mr. Chairman. It's nice to have some senators with fresh energy. I hope they keep it because Senate needs some energy, good energy for sure. I actually kind of agree with some of my colleagues on the other side that the Obamacare wasn't really the only reasons why we have these problems, but it was a big reason for consolidation. I think you covered few items. One good thing, so-called Cadillac tax, which really should have been limitation instead of tax, was actually repealed on bipartisan basis. The only cost controls we had there, actually was repealed by both parties. So we have this unlimited subsidy goes through tax, by tax system into healthcare. And when you have unlimited spending, companies are going to not manage their finances as good if they have unlimited deductions. So I think the limited deductions actually help all the CEOs and CFOs to do better. Mr. Roy, you know about physician provide-owned hospitals, right? There is a prohibition. Is that correct?
That is correct.
Yes, so provider competition doesn't exist now. Now hospitals own most of the providers and put them in crazy non-competes, and consolidation and oligopolies lead to what? I mean, this is simple economics, lead to huge inflation in price. When you have oligopolies on every market, and I think Mr. Fiedler would kind of defend inside neutrality, but there is nothing there to defend if you, for the same services, trying to overcharge, overbill, by physician practice, provide the same services, and have an ability to overbill and lie, truly lied to the federal government, hit $100 billion over billing and fraud in Medicare that a lot of these hospitals are doing. There is no reason for it except true fraud, but that's a legalized fraud, but because we're allowed to do it. So there is so much legalized fraud in Medicare Advantage and Medicare, in Medicaid, that we cannot keep up with. In Obamacare, the government accountability offices keep sending us reports, and as a former auditor, when I read them, I'm like, OMG, any private company, everyone would be in jail, but that's government. So we continue defrauding the taxpayer and bankrupting the country. So there are a lot of prevention in, that pay, for actually bigger money. If you consolidate it, you have ability of a charge, and Obamacare allow this consolidation and reward it for them. And, and a lot of things were not defined, like charity care was not defined very well. It needs to be tied in. We have a lot of so-called non-for-profit, tax-exempt hospitals that are able to make a lot of profits and provide no charity care. And no one even audits them because we don't have rule. Antitrust doesn't apply to them because it's not under jurisdiction. And a lot of very clever people went to Senate and did exemption for residents not to be able to sue hospitals if they abuse them. They put antitrust exemption. So we, as the government, put a lot of laws to actually benefit large cartels, because all healthcare now is so vertically integrated, horizontally consolidated, we have a cartel problem. This is a real reality, and we do a lot of debating here and drama, but in reality, if you have a lot of power and government helps you and protects you, you will try to abuse, the people, and that's what happened. And people not get better healthcare, and we also, the same government is go bankrupt. So everyone is going bankrupt. 1 in 6 Americans insolvent for medical debt. States are going bankrupt Medicaid. Federal government, $38 trillion of debt. I mean, it's insanity. Employers, large employers are struggling. Smaller businesses are struggling. And we're here still debating, do we need to give more subsidies or we have to do something? It's failed, obviously. The market, and we'll reach to the point where some colleagues on the other side, like Bernie Sanders, wanted single payer, taxpayer, and people will get tired. And honestly, people will say, enough is enough, I'll take whatever. I think it will be awful for innovation and will be awful for healthcare in our country, but people will get tired. So I think we have to find a bipartisan way to move this issue forward beyond politics and at least allow some arrangements to have more competition. So if you, from Mr. Roy, maybe I'll ask you, you kind of cancel, answer to me a few questions. But if you say, what would be good? Because insurance market, you cannot even have guaranteed renewable product because of Obamacare on the state markets. And if you cannot do it for consumer, then you do the service to consumers. So you have to, Obamacare prohibits you to have these services. What do you think maybe like association health plan and other arrangements we need to do to provide more competition on insurance market and more competition on provider market?
Well, first of all, thank you for all of your courage on this issue of hospital consolidation, both in Congress and in the Indiana state legislature. You're one of the people who really everyone looks to on this issue. On your question of how do we incentivize healthy behavior for people who are enrolling in the ACA changes. One of the things I talk about in my written testimony, and I addressed it earlier today, is the ability to have longer-term insurance contracts. So if you have a 3 or 5 year insurance contract, this is what Switzerland does. You can actually offer, and in Switzerland, you can offer refunds to people who meet certain thresholds like lower weight or lower blood pressure or lower A1C hemoglobin. So those are some things that we could do that would take a statutory change, because right now it's illegal to charge people different premiums based on their health status. So that's something we'd have to fix statutorily. In terms of your point about the broader issue of healthcare costs, there's a lot we can do. Again, this is a topic that can be very broad, but specifically on the issue of hospital competition, I would raise the Hospital Competition Act, which was introduced in the House by then Representative Jim Banks, who's now obviously in the Senate, and it was introduced in the Senate, I believe, by Senator Braun when he was in the Senate, and it's also part of a larger bill called the Fair Care Act. That has a lot of mechanisms to not only address the consolidation that will occur in the future, which is a huge problem, but we also have to address the consolidation that's happened in the past. We have to create incentives for deconsolidation without using the heavy hand of antitrust. And I would argue that the best way to do that is to limit the market power of hospital monopolies and make sure that they can't overcharge consumers.
Thank you, Mr. Chair, as I gab here with my colleague. Mr. Roy, I have to warn you, you have almost nowhere to go but down in my estimation, because I was bouncing with another hearing, and I got as far watching on YouTube as the first half of your presentation. I was thinking, I love this guy, and I'm waiting for the but. So I didn't see the second half. I'm hoping there's no but I just want to warn you that you're. And specifically, I've always maintained that we get, as members of Congress, people who represent some corner of the healthcare industry will come in and assure us that their corner is the purest and best part, and if only we would help them out. And we very rarely get holistic views. And I think the basic holistic question is, what countries spend the most on per capita on healthcare, what spend the least, and what get the best health outcomes? And I think, chime in if you disagree, that mortality amenable to healthcare is about as good a statistic as you can get that kind of sweeps in, adjusts for social determinants of health and what have you. And every time I look at that data, there is no country with lower mortality amenable to healthcare than the Swiss. And they spend about a half as much as we do. The UK spends less, but their outcomes aren't as good. And I got to that point in your hearing, and I was like, this guy's loving the Swiss. Like, love it, like, bring it on. And I guess what I'd love to have you finish, and apologies if you already repeated this before, it's always struck me that the Swiss have, number one, universal coverage. Every country that has better outcomes than we do has universal coverage. But number two, provides choice, which keeps everything disciplined, that you can hop between the systems. I think one of the things we messed up in the ACA, which I wasn't here, so it's not my fault, but not affording the public option to put some choice on some of the systems. And I guess, number one, do you agree with that? But I wanted to just pick it before you answer on, in your opening remarks, you'd mentioned that some of the incentives are not necessarily the problem. And it strikes me that when we're providing much higher reimbursement rates for specialty services than we are for preventative care, we're sending a signal to doctors about what to prioritize. And in my head, if we could change just one problem in Medicare, getting reimbursement rates higher for the things with the best long-term benefits would make a difference. And I just comment on that. Try not to let me down, but if you do, it's my fault for missing the second half of your time.
Well, I'll do my best to give you the elevator pitch version, given the chairman has already critiqued me for my long-windedness. Yes, short answer is yes to the Swiss as a model, and they don't have a public option. Let me focus on maybe that element of the question, given all of the topics you raised. What they do instead,
and I mean that only in the sense that, like, we don't have choice. Once you're in the Medicare system, it's hard to swap in, or VA, right, or whatever. So the public option would have afforded choice to keep the other systems more disciplined.
Right. So I'll say two things. One, I think the way Medicare Advantage determines rates is kind of an interesting hybrid model, because fee-for-service is kind of a ceiling for Medicare Advantage plans. If you participate in the Medicare program as a provider, you have to accept the Medicare rate. So that gives Medicare Advantage plans a bit of negotiating leverage with providers in a way that in the employer system they don't have. So that's an interesting model. What the Swiss do, which I think could be something that Congress adopts here, is they have an interesting system where the trade association for the insurers at the state level or the cantonal level can negotiate with the trade association for the hospitals or the drug companies to negotiate the reimbursement schedule. And then there's an arbitrator on top of that. And that allows them to keep prices in check, because if there's a hospital system that's a monopoly or an insurer that's a monopoly, that's basically canceled out by the arbitration mechanism. And that still allows for a market-based system for prices, but addresses the real problem of monopoly power, which is something that in our system we haven't addressed well outside of Medicare.
So with a minute left, I want to pick on that. And just a piece of math, if we could get to the per capita cost of the Swiss, it's $2 trillion a year of savings in consumers' pockets. Like, this is, I think that's a big number. Question either for you or Mr. Fiedler. I come from the energy industry. The energy industry, like the healthcare industry, is and will always be half pregnant with capitalism. There's parts where we want price incentives. There's parts where we don't want price incentives. In the energy industry, the way you made tons of money was by sitting at the point where you could arbitrage the spread between those two. I mean, that's essentially what Enron did. So where should we be most concerned about arbitrage in the healthcare system between the public benefits and the for-profit parts of it, where we can close some of those barn doors?
I'll try to give a very brief answer, which is the amount of arbitrage is massive, and the way you get to the bottom of it systemically is to have more people buy their own insurance rather than having it through another third party purchase it for you. But I'll leave the rest to my colleague.
I'll say the clearest cut arbitrage we're seeing right now is hospitals buying up physician practices so they can relabel them as hospital outpatient departments and get higher payments from Medicare. Right? That's just a clear-cut arbitrage opportunity, and there's no rationale for it.
Thank you all. Yield back.